Good morning, good afternoon, good evening, everybody. Friends, allies, enemies, comrades, ladies and gentlemen. It's such a pleasure to see so many faces here as we gather together virtually to prepare for what I think is fair to say is going to be one of the most consequential World Health Assemblies of our time. As we see the organization's greatest donor and the world's biggest power going rogue and intending to withdraw from the organization. Um, and Tedros recently announcing major changes to the programs of WHO that could affect so many of the essential services and programs that people on the ground depend on all around the world. We have a wonderful panel upcoming that we're going to get to in a few minutes. But first, I just want to share a couple housekeeping points. I suppose, first of all, I should introduce myself. My name's Ben Verboom. I'm a volunteer with PHM's Global Health Governance Program. I'm also a lecturer in global health at Queen Mary University of London, and I come from Canada. Um, we have for the webinar, we have simultaneous translation available in English and Spanish, and we'll have content this afternoon, this morning, this evening, wherever you are, in both English and Spanish. So please do choose the setting that's appropriate for you. If you can't see it at the bottom of your Zoom screen, it might be under the category More that says More. If you click there, you'll see a button that says Interpretation. Please do select the appropriate setting for you. The last thing for me to do is to introduce the chair of our panel, and that's Dr. Juliet Mattijsen, who is a physician and activist, researcher and writer. She's the founder of the People's Health Movement Netherlands chapter and is also a co-coordinator for PHM Europe. Um, and she's for me at least, a very inspiring friend and activist who's super active in the Palestine liberation movements and the climate justice movement as well. Juliet, I'm going to hand it off to you to introduce our super esteemed panel of speakers and to take it away from there. Over to you, Juliet.
Yeah, thank you so much, Ben, and welcome to everyone here. It's such a pleasure to be here. Just also wanted to share how I'm sitting here. I just came from the new occupation at the University of Utrecht by the students, and that gives me a lot of hope to see so many young people and staff also speaking up. And I also feel a bit the rush of it still in my body and the excitement. And yeah, so that's also how I'm sitting here. But I believe that feeling, that rush, is also a good thing and might get us into true and sincere conversations. And yeah, we are at a very interesting, horrible, and maybe hopeful point in the world. Let's see where that goes. And I'm really looking forward to having this conversation with our esteemed panelist, which I will introduce. So first we have Nicoletta Dentico. She's a global health expert and journalist and human rights advocate with a lot of experience in international policy. She currently works for the Society for International Development and has been a strong voice for challenging corporate power. And we also have with us Harris Kleckman. He's a senior fellow at the Center for Governance and Sustainability at the University of Massachusetts, Boston, and a former official with the United Nations. And we have, of course, Baba Aye, a labor and health policy expert, currently working as the Health and Social Service Officer at Public Services International, which is the Global Federation of Trade Unions. So welcome to each of you. And yeah, I think these introductions are always a bit formal. And I think in the first question, I should also have to give you the opportunity to a bit tell us about yourself, and what I'm always curious about as a young academic and activist as well is how you see yourself maybe as an activist, and maybe also to bridge that to the coming WHA. So how do you bridge this will for meaningful change and your work at WHA? Nicoletta, maybe I will give you the floor first.
Well, thank you, Juliet, and thank you all for inviting me to this very important conversation where I think, we learn. I don't see any distinctions between those that are just, asked to throw a few thoughts and those who are listening, who are here. I'm hoping also for questions and, complementary reflections. Well, yes, as Ben mentioned, this is going to be a very important meeting of the WHA, or rather, it could be, I want to just start provokingly, could be also the beginning of the end of the WHO, or the WHA being the, slimming strategy that really is ongoing, that is started, and that I think will continue. De facto hollow the organization to such an extent that you can be dead even if you are alive, or you can be in a way a dead institution walking. I mean, with a few.
It broke up for me. For also other people.
Yes, also for me.
Yes, Nicoletta's she's also frozen for me.
Okay. So maybe I can pass it on to Harris if that's okay, and then we'll hear more from Nicoletta. So the question was, how do you see yourself as an health activist, and how do you look at meaningful change at next WHA? And then we'll hear from Nicoletta when she's back.
Thank you for inviting me to join this conversation. For me in the morning, for others around the 24-hour clock. I think I wanted to make really 3 points in this conversation. One is that the policy making about health in the world is not historically and practically in the WHA for a while. It's been in the corporate executive offices deciding which drugs they see in the future as potentially profitable ones, which prices they set for pharmaceuticals going to developing countries, which arrangements they make to allow their licenses to be used to manufacture at a lower cost. And I think that one of the responses to your question is that when we now talk about the geopolitics of the WHO, or in fact the geopolitics of the multilateral system, we really need a different conception in our mind, is that it's not just the states and the powerful states that are hiding behind the phrase geopolitics. And I'll return to that in a moment. But it's also the key industries that relate to that particular specialized agency, in this case, the World Health Organization. And so geopolitics really ought to be a phrase that encompasses both the power of the powerful states and the power of the powerful industry. And we should understand that phrase in a way that puts us on a clear analytic direction. We're trying to get one part of that, which is the states, to take some action, but they are both potential allies and potential opponents, because they are structurally so aligned with the way in which the global pharma industry operates, that is the structure we should now be talking about geopolitics. I think the thing in geopolitics at the moment is they keep changing so quickly. One firm makes this decision, one government makes that decision. They have different impacts. In some ways, one wishes that there was a sort of a Xanax to geopolitics, so you could get a few hours of respite from the speed of changes which are occurring. And that geopolitics, as I say, is a combination of the firm's behavior and the state's behavior. But we do have to break it down that when that competition at the state level could be Europe and China, it could be the US and Europe, and the firms which are based in those countries. And so we really need to realize that there are multiple geopolitical struggles going on simultaneously. The other observation I wish to share is that we need to work out a new vocabulary. There's not the global health industry. It's a global unhealth industry. And maybe someone could get some better names so that in our normal discourse, we make clear what we're talking about. And that comes back also to the question of money. And I think this is one that we have to be sophisticated about. Let's say you're sitting in the DG's office as one of his senior staff, and he says to you, look, our biggest daughter is saying we're going to leave, our biggest source of money. And we're not sure about some of the others. And some of them are paying late. What are we going to do to meet the minimal levels that's being requested out of the World Health Assembly or that initiated out of the DG's office? And we have to become aware that that's the kind of question that's in front of of a DG or of a SG. And what answers do we really want? One part of us is clearly arguing no corporate funds, because that'll distort the industry to in the health area, to one that de facto privatizes the industry and privatizes the role of the agency. On the other hand, where are we going to find the resources to make the world a different place? And I think that we ought to have explicit conversations about the financial issues around the broader topic of geopolitics in healthcare. Thank you very much again for inviting me to join the panel.
Thank you so much, Harris, for that introduction, which was wonderful, I think, for the rest of the discussion. I heard from Nicoletta that she's trying to get back in again. And then I will give the word to Baba. So it's not your main question that I will ask you later, but more kind of an introduction on how you got into activism and how you're looking at the next WHA as a person and activist and part of PSI. So looking very much forward to hear from you.
All right. Thank you very much. Becoming a health activist is in several ways very personal for me. When I was 10 years old, I had an accident. I was in the hospital for like 2 months. And the kind of care I had from medical doctors, nurses, other health workers, I was convinced that the greatest labor of love, of course, that is not to say without remuneration, anyone could provide was as a healthcare worker. So I entered medical school. But this was during the military dictatorship in Nigeria, and I became both a student activist and a leading voice in the pro-democracy movement. So after a series of repressive measures, detentions, torture, I got expelled from medical school. My heart, however, was still with healthcare workers, and I decided to equip myself to be able to fight for healthcare workers and access to quality care for people. So I went and studied industrial relations and personnel management with the intention of being a trade unionist in the health sector. And that's what I've been now for the past 26 years. First in Nigeria and over the last 9 years in PSI. So And talking of the WHA78, as many have said, this is a pivotal moment, not only for international health, but for the world. Actually, some of the crises we see, I mean, which is even some of what we're discussing today, reflects the conjuncture we are in now. It reflects the current global situation and its contradictions. So, yeah, probably I stop here now. Or otherwise, I could go on with my question. But since you say that is just to speak.
Exactly. I thought it's just nice to know a bit of where you come, like where do you come from as an activist before we hear you in the questions that we are going to ask. And then we have Nicoletta, who's back with us. And you started with a very powerful glance of where we are at the world. I think you're back with us, right?
I am.
Yes.
Indeed.
And then suddenly you got interrupted. So
I'm sorry about that. I changed my position. And yes, I started with a provocation. You know that Italians are good at doing this, and we are not so polite as the rest of the world. So as a matter of fact, for me, there is an event which happened yesterday, and that was our WHODG meeting Bill Gates. Well, to me, that says everything. The process towards disempowering WHO through a very surreptitious form of financing that is the way in which this enormous power that has been in the organization for the last almost 30 years now, and which has, penetrated like a worm inside the organization, destroying its integrity, destroying it. Please, can someone mute, because I'm hearing. So destroying it and in a way changing the overall political culture around health, changing the modalities of working, hybridizing the setup, the governance setup. I was in a conversation recently in Kuala Lumpur talking to one director of departments of the WHO. She was challenging civil society because she was saying that when people from the secretariat or even member states talk to civil society, they never know, how private we are, how we represent the private sector. And I said, okay, I hear you, but that's exactly the opposite. When I, as a rather seasoned civil society person and health activist with quite a long experience, because I've been interacting with the WHO since 1999, and talking to some people of the WHO Secretariat or other people that are moving around the WHO, including some so-called non-state actors, I really always wonder what is the power? Who is this person really representing? The public function, la función publique de la OMS, of the WHO, or rather some sort of seconded interest that has been inserted in the organization. So it is a very crucial time. I think there is also a fantastic opportunity at this point, in a way, to lift the table and get rid of a very ineffective way of conceptualizing health, public health, global health. I think we needed to start talking about global public health, because not having inserted that adjective for the last 25 years has allowed a lot of private interest to enter and a lot of financialization tricks to occur around health rights and health needs. So I see this also a wake-up call for all of us to reduce and shrink also the NGO industry, the civil society part of the problem as far as we are concerned, to really understand who we are. But particularly for governments to go back to the core of public health values, principles, to the core also of a serious and credible multilateral game that is so fragmented and so blowing up at the moment, because governments themselves have, in a way, incorporated a private mentality and a private short-termism in terms of results, in terms of outputs, in terms of outcome, that is really the worst enemy of what health policies are. And all this idea that we reduce a pandemic response to projects that are enshrined in a pandemic fund where everything that is global basically reflects the same hierarchies of dependencies. Well, I think this is something that we had to suffer for the last 30 years in a very profound way. I hope, and I will, in my activism, I want to do whatever is possible at my age, which is kind of advanced at the moment, to really make this moment of dire crisis a real moment of serious opportunity to change this the system in which we are, which is, I think, very pathological, and to perhaps work for a WHO, which I will never see myself, but needs to be maintained, because if the WHO continues to be the entity it is at the moment, I think we are a civil society and people like me who cherish institutions as something that is even moving, as Pierpaolo Pasolini used to say, into something that it is very difficult to believe in and it is very difficult to trust. So I think it is a moment of epiphany. It is a moment of being serious about what public health means. Over.
Yeah, thank you so much, Nicoletta, and the three of you. I think with your broad answers, you depicted each different part of the story. So how the geopolitics of the world also lies mainly outside WHO and the corporate power, what you said, Harris, but also how as a health activist, you need to equip yourself and that you need to organize, as Baba described it. And what I love about what Nicoletta said was also to ask the question, who is sitting in front of us and what are their interests, but moreover, to see opportunity in a very dire situation in the world. I think that's also what many progressive thinkers have told us, like Marx, who tells us to think from the poetry of the future, that we have to have some hope and to fight for the hope that the world that we believe in. And that's also the conversation that we will have hereafter. So we have chosen 3 different topics to go a bit deeper in. And for each of the panelists, I will take more or less 10 minutes. And please, for the audience, do ask questions if you have them, because I think, as Nicoletta said, it's really nice to have a dialogue and also to create thoughts and an idea together to what WHO we should work towards. And there are also important topics, obviously, that we will leave untouched, thinking, for example, of the destruction of the climate crisis and the genocide in Palestine in the questions, but in the answer, please intermingle everything that's happening in your heart and mind. Baba, I will start with your question, if that's okay. So that was what we discussed was to discuss if you can comment on how the WHO's work over the past decades has impacted health workers' struggles for public services and better working conditions.
Thank you very much. I really like that question, and that is because it centers workers it centers the agency of workers, the struggle of workers for public services. But it also underscores the importance of the WHO, largely, and which is where I'll focus on the normative role it plays and how this presents us with institutional fulcrum for the associative power of workers, particularly so healthcare workers, in fighting for universal access to quality health and strong universal public health systems. Over the last decade, it's quite, you said 10 decades. In 2015, it started with the global strategy for the workforce by 2030. A lot of work went into that by the Health Workforce Department of the WHO. And this was what put starkly in front of everybody's eyes what's from anecdotal knowledge was obvious, that there was not only large shortfall of workers, but that this was likely going to get much worse. And that by 2030, it was projected that you'll have an 18 million shortfall. This served as a basis on which you then also had the work of the United Nations High-Level Commission on Health, Employment and Economic Growth in 2016, on which the then General Secretary of PSI represented the working class, which Rosa Pavanelli as a commissioner of the high-level commission, and which tried to mobilize support of get political commitment for what is what of governments to that. So these are powerful systems, and from that it came up the Working for Health program. And there have also been a number of tools flowing from these, like the Global Health and Care Compact, which brings together a compendium of all subsisting international covenants and several relevant national legislation that that could be used by health workers to protect themselves. Then you have more specific ones like the work on the community health workforce guidelines, which was in 2018, at the time of the Astana conference. And that was very important because that was the first space where it was made explicit that, community health workers, you still have some governments doing it right now. Community health workers working normal working hours cannot be considered as volunteers and should be paid. Now, what are the importance of all this, and how do these relate to where we are now with the shortfall of materially of the WHO and all that, and how does this serve for us as workers, as trade unions? Good. So for us, our affiliates, and with the support of PSI for them, have been able to, resting on these normative frameworks, been able to push for improved funding and what have you. But this is part of the problem, that because what is happening with the WHO, we'll talk further about this. It's not just with WHO, it is, as I said earlier, part of a broader crisis of the current conjuncture. And I'll speak quickly to in Africa, our affiliates have over the last 2 years been pushing for their governments to take note of the Abuja Declaration of 15% funding for health, and the need to invest in health workforce. And there's a particular where things were going on right before, and when they went this year that it should be, and they were like, how can when we have to put in $200 million US dollars extra as a result of what's the pulling out of the United States of parts of North America from the World Health Organization, the whole it brings about. So and lastly, I'm looking at it, but lastly, we should also look at the workers in the WHO itself. These are people doing great. A lot of people working there. It's just like I gave my own personal experience. A lot of people, it comes from the heart. It's not just work like a job. Of course, everywhere you see people that be careerists and all that, but a lot of people we know, we've worked closely with. Excuse me?
I think someone, if you can put off your mic.
Okay. So a lot of them
sorry,
around about 2,000 people will be laid off. This is serious, and it speaks to where it also speaks to years of neoliberal policies, because part of why it is that quote unquote easy is not just because of the money people, but it's also that people have been working. I think this is probably deliberate bombing. If you can identify you pull it out. So it's that years of and both Aries and Nicoletta spoke to this of, you have had steps being taken over time that brought us to where we are now, although where we are now is a big bang of where we have been coming from. So workers in the WHO have been working mainly about 3/4 or more on fixed term contracts that have to be renewed every year or two. So that's part of why we're where we are now. But lastly, and I'll sum up here, is that our members, our affiliates, are not going to relent. Is still putting the feet of our governments, the governments of our countries to the fire for improved funding of public health care delivery, for the primacy of public health care delivery. Privatization does not help, is not any more efficient. And this is also because there's an ideological element to where we are now. Even within the WHO, issues of it might not matter whether it is public health care or private, so long as it delivers. And it is not so. And the need to fund health workforce for all, because without health workforce for all, we can't achieve the goal of universal access to health. Thank you.
Thank you so much, Baba. And sorry for, I don't know if you heard the sound interruption on my side. There were a few, but I think the story was quite comprehensible. Do we have any questions from the audience on the health workforce? I see none. Oh, I see one. Moga, would you like to open your mic?
Yeah. Thank you. I mean, obviously I agree on all what you're saying, the dangers of corporate funding and all that. But the problem is WHO, well, global health in general, but let's say WHO itself is a real funding crisis, as we all know. So where do they get money if governments don't want to pay? I mean, firstly, the gap of the US, the US doesn't want to pay 2024. I mean, before all this, before Trump came to power, and they don't want to pay that. But of course, nobody can force the UK to do the US to do anything. It's just bizarre. But if it's Cameroon, you suspend their voting power. But with the US, well, they left anyway. So it's so I do understand why they're going to Gates. And also I hear there's another foundation that they're going to for. You come to developing countries themselves, they're talking about, everybody's saying domestic finance, increased domestic finance, as if domestic finance is sitting on the beach waiting to be taken and put on health. That will not happen. And also, or it will be limited, like what Rwanda's doing. But the other thing is debt relief. I think we need to talk about debt more and more. However, we shouldn't say debt relief or debt programming or debt structure or debt anything without clearly tying the debt to spending on health and education. Otherwise, it will be spent on goodness knows what, and we stay in the same situation. So it's debt relief to go to health and education, to go with accountability and transparency, so that people in the country, not donors, but people in the country know how much they should have paid. Because actually what we pay as developing countries is not the debt, it's interest. We're not paying debt. We still own the debt, but we pay interest. So as a human being from a country, I need to know that my country is not paying $100 to the US or to the UK this year. The $100 going to health to fund X and Y and Z, and therefore I can actually monitor if the money has gone there or not. And there has been examples with the first debt relief that the UK did, goodness knows when, it was years ago in the 90s. I mean, I remember I was working for Oxfam and my colleagues were working with Uganda. They managed to get the debt relief to Uganda, and they managed to program to monitor if the money is going to the schools and this governorate or in this place and region in the country, and did it mean that the teacher's salary was paid? Did it mean the kids had books, the school had a roof, whatever? So they had certain things to monitor for. It was for education. So I think it's possible. But then I come to the other question about funding, which is for civil society to be able to advocate and to monitor whether civil society in the South or even in the North these days, we're not funded.
No.
And there is no money. So it's really kind of catch-22. It's very, very, very hard, but at least we can say debt with accountability, debt for health and education, not just debt, full stop.
Thank you so much, Moga, for raising these important points about the crushing debts that prevent necessary public funding as like housing and education, and also the underfunding of civil society organizations. Baba, do you want to have a short, very short response, 2 minutes maximum, before we go on to the next speaker?
I agree totally with what Moga said. I mean, and this speaks to some of the arguments we made as the Geneva Global Health Hub regarding how we need to do away with the false gods. Because when you look at, to draw from Chinua Achebe, he said that we need to know where the rain started to beat us. And as I said earlier, it's about this neoliberal approach, including in the health, the introduction of user fee, in short, the commodification of health. There was a shift, a change, and it's not just about debt cancellation, which are important, but I always emphasize something. I say, often a lot of us remember that the Alma Ata Declaration, its slogan was "Health for All" by the year 2000. But one thing that is often forgotten is that there was a caveat that it will be possible to achieve health for all by year 2000, and you can say by any time, without a new international economic order. Of course, they were drawing from the poetry of the 70s, which was 1974, the NIEO. And I like what you said about the poetry of the future. But what happened was that instead of a new international economic order along the lines of what even the United Nations adopted based on the proposals of the non-aligned movements, you had a vampirish zombie order of neoliberalism, of commodification of any and everything, including things that should be held almost as sacred, even if in a secular manner, like health and education. So we need a new order that puts people and planets over profits, that puts health before wealth. And we win this only with struggle. And we need to win more champions, both within states, but from below as well. So thank you.
Thank you so much, Baba, for your response and the context you provided. Okay, so we'll go on to the next question, which is for Nicoletta. And I'm sorry we can't dive deeper into these topics, which are obviously more complex and we have time for. But this is a topic you've been also working for and been interested in and worried about. In the recent years, we've seen pushbacks against the rights of women and LGBTQ plus communities by quite a few member states. How do you see this dynamic playing out in the context of the WHO's current emphasis on identifying priority areas of work? And before you answer, I was asked by the interpreters if all the speakers, including myself, can speak more slowly.
Yes. Thank you, Juliet. Before I get into the pushback on women, allow me to just complement a bit or try to respond to what Moga was saying. The problem is that today the kind of slimming strategy for the WHO is carried out by the Boston Consulting Group, which is a consulting firm that knows nothing about in public institutions, and this is paid by the Bill and Melinda Gates Foundation. So I'm sure we have a lot of thorns that we have to really address, a lot of knots that need to be untangled. It is not just a question of financial, investment. Yes, of course, money is important, but I think it's also what we are going to do with the money that we want, because if we continue to look at health just in terms ex post, just in terms of biomedical solutions, this is going to be extremely costly. There is a lot to be done on other sides of health, prevention, policy, health promotion that are so less costly and I think so much more effective for health globally. But this is just, to be continued, so to speak. Yes, the pushback on women's rights is something that a recent report of the UN Women trying to take stock of the 30 years after Beijing conference proves with numbers. Basically, it says that in 2024, 1 out of 4 countries have reported a backlash, a serious backlash on women's rights. And of course, we know that gender discrimination is still very much embedded in societies. What we have seen, however, in the last few years is that gender discrimination and a very misogynistic wave of policy talk is affecting dramatically also multilateral institutions. This goes hand in hand with the restriction of the civic spaces, not just at the WHO, but in the system of the UN. And we cannot underestimate how restriction of the civic space in the UN agencies affects immensely not only the advocacy capacity of all women's rights and organizations, but particularly even more, especially in a conservative setup like the WHO, the gender minority groups that we should not forget that they don't yet have a voice in the WHO, whereas they have a voice in other fora, the UN Council, Human Rights Council, FAO, and elsewhere. So we have a serious structural problem. In fact, the WHO, as I said, it is a global, it is a systemic UN problem, and this is also happening not only in the UN, but in other in multilateral structures. But of course, the WHO being the one agency of the UN dealing with human health, it is also the venue, the institutional venue where this attack on women's rights and the gender agenda overall is being pursued more directly, more visibly, and I would like to say also more violently. This attack on women's bodies, when the delegate from countries, continue to say that the sexual and reproductive rights are not human rights, don't exist. This is a real attack on women's bodies. And I'm saying this also with being cautious that, women's rights are not just limited to their social reproductive function, but certainly when you deny the fact that women's relation to health and to the health agenda has its own specificities, and that also other gender minority groups have to face issues that are related to their bodies, to their body, and the body is used as a battleground by the regressive internationalist that is movement that is moving around the world. This is actually a very serious problem. I can also see the emergence at the national level because, as we all know, the international WHO setup is also the result of national policies. I also see don't have much time to elaborate on this, but a wave of womb politics around how many children women are supposed to be having in order to re-establish the national race, as is the case of Hungary, or to make sure that one religious minority doesn't overtake the religious majority, as is the case of India. So the women's body is really the battleground, and we cannot here avoid to speak about the huge price that women are paying in conflict areas, particularly in Sudan and in Gaza. They are actually by far the widest proportion of the victims, of the people that are really attacked. So we needed to really seriously take into consideration the pushback against women happening at the UN and happening particularly at the WHO. We have seen this change of dynamics. In the past, it was primarily some members of some Arabic states objecting to some of the, wording in the documents. Today, it is a white man coming from the north. It is usually the delegation of Russia that starts the discourse, and then others follow. You have Argentina, and then you have Hungary, and then you have the usual suspects, plus the Holy See. I take the responsibility of naming them because we can't hide ourselves, saying that this is happening. We also have to call people to their responsibilities in what is happening. Yes, sexual and reproductive rights, as I said, are the battleground. Now, why am I worried? I'm worried because also having talked to people in the WHO Department of Gender and Women's Rights, there are a series of structural problems that I think are going to be particularly delicate now that the cuts and the restrictions and the slimming of the WHO is going to take place. First of all, because the gender department was already pretty small. It has no regional posts, it has no regional network, and it is really truly under siege, as we were told. They are the ones who are actually asked by member states and the secretariat to change and to amend the current semantics and actually to change the language that has been negotiated language for quite some time. The other problem, structural problem, as we were told by the people, not only in the WHO, but also in the Human Rights Commission, is that there is no unified policy or not even unified definition on women's rights and the gender agenda across the UN. So this is another element of vulnerability that needs to be addressed. The funding cuts, of course, will attack these structures within the UN agencies quite probably, and this is something that, of course, should be of our concern. And finally, what I'm seeing and what I'm hearing is also the fact that because of this regressive misogynist movement has a lot of financial support, contrary to what to our situation, as Moga was highlighting. They have a lot of money, and they also have a lot of support, financial and political, from various religious groups. I will not be surprised in the next few years we would bump into new forms of state actors, new representatives of state actors, the pro-life, all these conservative groups that are anti-abortion groups, and all these associations and entities that are actually, brewing and multiplying, certainly in my country, but also in other countries in the world, because they are fed with the financial support that we don't see anymore. So I see a rather gloomy future in that respect. And I will stop here. Thank you.
Thank you so much, Nicoletta. And what also struck with me with what you said is the explicitness of the pushing away of rights of women and gender non-conforming people, and in a way the normalization of pushing them away from what we accept as rights, people that hold rights, and that language is not neutral, and in a way, it's gliding down. Do we have any questions for Nicoletta on the intervention? Okay, otherwise I would have many, but Eduardo.
Nicoletta knows very well my position because we have been working together in the last, what we shouldn't say, 30 years or possibly more on the issue. She mentioned that she entered in touch with the WHO in 1989 or 90 something. So I have been dealing with WHO since 1987. So I met almost every single director general and have been really in the intricate matter of WHO since a long time. Now, the big issue today, I'm looking at financing issues. The financing issue, because it's a #1 issue with US leaving the organization. I think that we have a problem which is not only about financing. I think Nicoletta already stressed this aspect, is about the WHO being captured by external interests, fundamentally. It is not only the, 12 to 15% of the budget which is paid by Gates Foundation for their own purposes. It is more, I would say, the action behind the curtain of those who influence WHO. Nicoletta mentioned Boston Consulting. I could mention many others behind the curtains to tell WHO what to do. So it's an issue of being captured not only through the financing, which is an important aspect, but also through other aspects. So besides thinking how we can refinance or make the financing of WHO somehow sustainable for the public interest, I think we should strongly demand for absence of conflict of interest, much stronger due diligence when dealing with external actors. Really freeing the WHO from the private interest. And this is a big, enormous battle in these times. But I think this comes first, then just thinking about financing. About financing, obviously, we have to struggle for having more, or following the agenda for having more core contributions. You know that today it's up to 80% of the global budget of WHO. It comes from voluntary contributions, which are mainly earmarked. There is a small proportion of core contributions, which allow the agenda to be followed, the agenda defined by the World Health Assembly and not negotiated bilaterally by actors. So I think we have to go into these kind of aspects. Obviously, there may be new financing mechanisms. For example, debt swap, somebody mentioned it before, could be used in order to finance WHO rather than the Global Fund, for example. These are mechanisms that have been used. Now, there is an enormous risk of leaving WHO alone, a risk that the global governance in health will pass to the global public-private partnership and to other mechanisms of private financing of health. This is the risk that I see. So I think we should really work on the independence of WHO for the public global health, which is not global public health, it's a public global health, Nicoletta. So for the public interests. But this should be really the big battle from civil society and all those who want to support, who understand the need for a fair multilateralism, which is among states, together with the allies, which are civil society, and for sure not the corporate sector.
Thank you.
And that we could discuss for 24 hours.
Yeah, for sure. Sadly, we have only 1 hour.
Yeah.
Thank you so much, and for also the nice touch of public global health. I will let Amitabha have a short intervention, then Nicoletta answer, and then have Harris in, because I think this also touches much on your topic, what has just being said. So, hello. If you could please do your intervention in 2 minutes, would be really nice.
Thanks, Juliet. Thanks to all of you for organizing such a lovely and very informative event. Just to share two of the findings from our current research on the pandemic treaty. One is that we found that the WHO Office of Compliance, Risk Management and Ethics, this is really very having a very low profile. And we found that this might be a mechanism within the institution to at least advocate for such kind of challenging issues, be it financing, gender, climate, and various other issues. And the second is that I'm going to copy paste the name again for the WHO particular department. And second is that we have identified a couple of human rights instruments and mechanisms that might be of help especially for this community to advocate. Like one of them is a special rapporteur on health. There are some treaty committees and charter-based committees that might be of help. And usually every June, HRC Human Rights Council, Special Rapporteur of Health, actually convenes meeting. I just thought to share two of our findings. Anyway, we are actually submitting. So, and also I will be happy to discuss with you all further. Hope to see you, most of you, in Geneva in a few days. Thank you.
Thank you so much. Nicoletta, would you like to react?
Yeah, very
minutes on.
No, less. I definitely agree with the public global health, but please let's introduce public, because words are important and they do shape reality. Second, yes, certainly, I totally share Amitabh's proposals. I think indeed that the WHO compliance and ethics department has and we've seen it also during COVID. I mean, we had a direct instance of this low profile and also this diminishing of its role bypassed by power politics in the WHO. For example, with the first Italian report on the pandemic, which was, as we know, a target of a lot of geopolitics. And I agree also. I think at G2H2 we were planning to do something already last year to have a closer interaction and a dialogue with the special rapporteurs, not just health, but also debt and finance and other topics, which I think are so important. Things are correlated much more. They have always been, but now finally we see them in their correlation. And certainly, as Moga was mentioning, and I mean, as SID, we have, and G2H2, we have pushed for a long time, talking about debt cancellation, talking about illicit financial flows, talking about fiscal justice is a public global health issue. That's our outline.
Thank you so much. Harris, would you like to also react before you get into your own question or extend on it? We can't hear you yet. Because you're muted.
Yes,
yeah.
Yes, thank you. Juliet, I'll share some views now and you can decide how to divide them up in different ways. I think it's really exciting to listen to the discussion. And I really want to share three observations that may be helpful as we think going forward with the WHO. One is that we need a sound counter to the expansion of multi-stakeholderism as a solution to health problems, health issues, however you choose the right words. We have to be able to start calling it global unhealth practices and begin characterizing these multi-stakeholder or corporate WHO partnership arrangements and get a better vocabulary. As Nicoletta says, that helps to define how we approach this. One element of that to switch the weight is to begin to think about how we do health taxing of the transactions involving health-related products, goods, and services. And come back with a counterweighted position. So we just are not arguing no multi-stakeholder, no public-private. What we are arguing is that all the trade in these issues should be taxed appropriately and put in a place partly shared with national authorities in the largely global South and partly shared with the World Health Organization. I think that in terms of talking about structural changes, you know, when in the financing for development process, I was on the early staff for that, we discovered there was actually a seat at the table of the WTO Council formally set aside for the UN. And I think that it'd be very helpful to campaign for a health chair at the WTO, where the argument is that trade ministers should know the health impact of the decisions they're making from a trade perspective on the countries that they're talking about, and try to move from the single exemption effort that did fail on COVID to one which actually puts health in the right kind of structural place. And that's not constrained to the WHA. Third thing I want to say is to move outside this box. We have been living with a system of state sovereignty as the appropriate base for international organizations since the end of the Second World War. I think all of us realize the weakness of the state, particularly the state operating internationally, given the power of transnational banking, and the transnational corporations involved in individual sectors. So I think we have to start conceptualizing what we would like to see in a reconstructed World Health governance system. Careful, I'm not saying a reconstructed WHO, I'm talking about a construction toward a health governance system, trying to choose different languages. And I want to pick up on something indirectly that Baba said, is that this may be an example where we can move away from a state sovereignty base into a different base for decision-making. So we could work on how this health governance system might be that includes in the governance process, not as lobbyists or advocates, but where healthcare workers are part of the governance system, where representatives of patients are part of the governance system, and that representatives of medical schools are part of the governance system, where we move from a sovereignty restricted mentality to one which is fundamentally different going forward for a global health governance arrangement. And we spend some time, maybe some dedicated time, to conceptualize how that would work. So we not only could oppose private-public deals with the WHO and the multi-stakeholder deals involving the WHO, but have another strategy for what we would see would be a constructive global health governance system. And I think I'd like to leave it at this point, Julie, to hear any reactions to these ideas. Thank you.
Thank you so much. And I'm very happy and relieved that you also talked about conceptualizing a new World Health governance system. Because at the second point at the WTO, I thought, ooh, don't we need a new order that's juster? But that's exactly what you were going at. So thank you so much. And I think it's also beautiful to end the conclusion, the end of the discussion with that. If there is a short intervention or question to Harris for this part, please raise your hand. And otherwise, I also think this is a beautiful bridge to the final question to each of you. And that is, how would an ideal WHO look like, the WHO we need? And maybe also, and that's also the question that's lingering from what you said, Harris, at last, how do we move towards that? Is conceptualization an effort of doing or thinking, or how are we going to do that? Big question, little time. So if you have just a few insights, inspirational insights to end this webinar in 1.5 minutes of last intervention. Harris, I can give it to you because I think you ended on this note already.
I would suggest that there are at least 2 first steps to reconceptualizing the participants in global governance, and then there's the programmatic side. Is that when the World Health Assembly meets in 2 years or 3 years, that parallel to it, there is a World Health Assembly of healthcare workers and health patients, so that the sovereign states have a countervailing force of listening and knowing that the policy debates that they are having, or the policy debates they should be having are occurring in this parallel assembly. I think the second area is we do have to grapple about the relationship with the World Trade Organization and intellectual patent control. And we have to figure out the first steps for that, but the one that as you heard me saying, is to campaign for a health chair, a seat at the WTO Council, who is invited regularly to provide input to the trade ministers about the consequences of decisions they're about to make, and to elevate health governance into the trade space. Thank you very much.
I muted myself again. Thank you so much, Harris. Baba, I would love to hear your answer.
Well, thank you. If we don't understand where we're coming from, it's difficult to know where we're going. And I think there are small rocks and big rocks, because we often see the big rocks as being so big, we focus on, but we cannot change things with only the small rocks. What I want to cast our mind to is that the World Health Organization itself was part of a movement in history. I mean, it was part of the post-World War II order. And don't forget, I mean, this was at the national level to some extent captured by Ken Loach as the spirit of 45, and it was also the period of, the spirit of Bandung, cooperation and all that, without reversing, because over the last 40 years thereabout, we have had a common sense of neoliberalism. No matter if we try to make cosmetic changes and without getting done with that hegemonic framing, we would go far. And that's why I said what has happened with Trump's emergence and all that is just like the fulfillment of a trend that had been going on even before now. So with regards to the small rocks, well, there are a lot of things that might be done, but without addressing that, we will really be marking time. In terms of the small rocks, I think some of what Harry said are quite apt. And to us, because it's more than just what do we expect member states to do, even if we put the WHO or the WTO, even if we have members, if they work with this mentality, it won't change much. So, but for us is to put pressure. It's for us as activists, as civil society organizations, as trade unions, to come back to that vision that was captured in those words that somehow they are not as popular as they. But even now, more than ever, we need to get back to asserting the fact that another world is possible. It doesn't have to be this way, and we need to fight for it like crazy to win what can be, to bring about a better WHO and a better world. Thank you.
Thank you so much. And Nicoletta?
Well, because I'm older than Baba, and because I want to see something happening, perhaps before I completely, close my interaction with the organization, I will mention a few things. Of course, it's not so much tinkering within the box, but certainly it is not I don't see the change of the spirit going back to Bandung or 45 as something within reach in my kind of biography. But I certainly think that it would be essential to push and really strongly push further about conflict of interest rules. The WHO is convinced to have the highest standards in the world, which unfortunately, paradoxically, it is true, but it's not sufficient as we can see. But however, conflict of interest rules don't function alone, and they are not sufficient alone. I think we also needed to look at the revolving door policies, because there were in the past there were very serious, strict national and international standards in order for the revolving doors to be, moderated, governed by a sense of the common of the public function of the state as separated from the private entity. So this for me is absolutely essential. Because something that we keep on neglecting is, for me, a dimension that needs to be highlighted is the privatized state. So it's not just the corporate, but also the state, which has completely been corporatized and taken up a corporate mentality. And finally, I would really like to see a very serious strengthening of the oversight function of the WHO. If you happen to read the documents, the reports of the Oversight Commission, you will see that a lot of the things that we say are spotted there. The compliance, risk management, and ethics is something that Amitabha was mentioning. These are minor interventions, but they could be, I think, tactically very instrumental to create the conditions for the WHO that we would like to see and within a lifespan.
Yeah. Well, thank you so much, the three of you, and for everyone that had very meaningful interventions. I thought it was a great discussion. And also a bit scary, but also hopeful, embracing this term of working towards a public global health, thinking outside of the box, to fight like hell, like Baba often says. To what Nicoletta ended with, the need to separate the state from the private, and what you ended with also reminds me of this song for Palestine, like in our lifetime we will be free. So hopefully in our lifetime, I believe if we embody that, that's our best chance as well to make the change truly happen. Also what Gramsci calls not the pessimism of intellect, but the optimism of will, and that's what I hear also in each of you and what I carry with me. So with that, 3 minutes past time, I will hand over to Ben to wrap up.
Thank you so much to all of the speakers, to Harris, Nicoletta, Baba, and of course Juliet, and everyone who intervened for, I think, a really sobering discussion on the future of public global health, I should say. I don't want to take up too much time because we only have 12 minutes left on the clock, so I'm going to promptly hand it over to PHM's global coordinator, Dr. Roman Vega. We started this discussion, Roman, talking about the disruptive nature of Trump, the advent of Trump in global public health. PHM's been spending a lot of time thinking about how to respond to this. And what's come out of that series of discussions is a position statement that I understand will be published very soon. And Roman has offered kindly to share with us a sneak peek of the position that PHM will be taking on this disruptive moment, and hopefully charting a more hopeful, progressive future for health multilateralism. So please do take it away, Roman.
Bien, muchas gracias, Ben.
Thank you, Ben. I would like to thank the colleagues on the panel for joining us in this first dialogue on the situation of the WHO. People's Health Movement and its steering council are currently discussing a call to action. It is a draft call to action. It is an urgent call to preserve, protect, and enhance the work of the World Health Organization. Therefore, this is not the definitive document. It is not the final document. We will have another meeting next Monday. We are currently discussing this position. However, I'm going to anticipate some of the elements that we believe are important regarding the situation of the WHO and the withdrawal of the United States. And this debate is based not only on the document, the draft document, but also the position of our colleagues regarding the situation and also my personal thoughts. We believe that the US withdrawal deepens the weakening of the WHO that began in the 80s with the emergence of an international health governance structure that progressively supplanted it, usurped its functions, reduced its funding, opened the door to voluntary private donors who imposed conditions on the execution of projects and programs, prevented the fulfillment of its constitutional mandate, and then ideologically dominated it almost completely. All of this occurred in the context of a neoliberal globalization that dealt a blow to the fundamental principles of multilateralism and handed over power in health policy initiatives and decisions, regulations, and program implementation to the World Bank, the WTO, to regional and bilateral free trade agreements, and to global multi-stakeholder public-private partnership initiatives. This was clearly an early raised in the movement by our unforgettable colleague Amit Sengupta in his analysis of health and health governance in the era of globalization. The weakening of the WHO was a result of a deliberate strategy by the most powerful countries of the global north to defend their interests and those of multinational corporations linked to the health business and activities harmful to health in the face of the rise of countries in the global south, recently freed from the yoke of colonial and imperial rule, and of the countries of the then existing socialist bloc. The influence of these forces prevented the WHO from implementing neoliberal policies of structural adjustment, commodification, and privatization of healthcare, and promoted decisions that, in response to the health needs of people impoverished by the imperialist plundering of their resources and the exploitation of workers, affected or limited the extraction of surplus by the developing medical, industrial, financial complex. The new developing trend of the global neoliberalization was the legitimization, the reduction of resources, and the weakening of the WHO. Now, the new developing trend of monopoly capital globalization intends to turn governments and United Nations agencies into private offices for their neo-fascist fractions and ignore multilateralism, replacing it with unilateralism. With the withdrawal of the US, for example, the WHO's financial crisis is deepening, forcing it to further reduce its technical and administrative capabilities, to withdraw a high percentage of its staff, to weaken its regional and national offices, and jeopardize international public health. This process, however, I believe it is one of the key elements of the People's Health Movement Declaration, may open an opportunity to transform the WHO, restore its leadership, and improve global health. For instance, the WHO could adopt stronger positions of principle, establish binding commitments, ensure sufficient and adequate funding for international health cooperation, strengthen its equipment and capacities, technical and scientific, with the commitment of states, overcome policies of commodification and privatization of health systems, contribute to lowering medicine prices and facilitating access, define stricter regulations to promote sustainable food systems, more effectively address the commercial determinants of ill health and social inequalities in health, and promote action on the health consequences of militarism, colonialism, and environmental devastation. Therefore, this could be an opportunity to decolonize and democratize global health governance by strengthening the participation of national governments, especially those in the global south, and public interest civil society, by overcoming multi-stakeholderism and better addressing the health needs of the most disadvantaged regions and countries. However, as Amit Sengupta mentioned, this cannot be achieved without the emergence of true globalization, that is to say, an alternative to the two projects of global oligarchic bourgeoisie built on the principles of equity, justice, cooperation, and multilateralism to meet the health needs of people. That is why PHM will surely, in its statement, call on WHO member states, activists, and civil society organizations to muster the necessary resources and the courage to protect, preserve, and strengthen the WHO. We call on WHO member states to rapidly increase funding for the organization so that it will adopt long-term, predictable, and unconditional contributions. We call on health activists, civil society organizations, and citizens to openly advocate for and fight for a WHO that embodies our aspirations and collective commitment to protecting and promoting the health of people and the planet.
Gracias, Ben. Creo que va a ser el espíritu de la decisión del
Thank you, Ben. I
movimiento.
believe this will be the spirit of the statement.
Roman, thank you so much. I can't think of a better way
Muchísimas gracias.
to conclude our discussion today, but also to set the stage for the World Health Assembly and for our activism and advocacy activities that we'll be undertaking over the coming weeks. So thank you so much for sharing that with us. We are at the end of our discussion today, folks, and I just want to conclude with big thank yous to all of our speakers and to our hosts, but also to announce two events that PHM will be hosting over the course of the World Health Assembly period. The first is a policy dialogue in collaboration with G2H2 and co-hosted with the Third World Network. This is to look back on the process and product of the pandemic treaty, which the WHA will be considering for adoption. That'll be taking place on Friday, May 16th. And you can go to the G2H2 website to look at how to register for this. You can join online. We'll also be having a hybrid event on public pharma, which will be hosted by PHM, our public pharma project. That will be Tuesday, the 20th of May. And that, as I said, that will be a hybrid event. So if you do happen to find yourself in Geneva on the 20th of May, please do make a point of joining us that evening. You'll find more information about these events in the chat. A final point is that, like every year, PHM will be sending a team of young activists, our WHO watchers, which is a diverse team this year from Sri Lanka, Pakistan, Syria, Egypt, Italy, Germany, the Netherlands, Uganda, South Africa, Canada, and Brazil, and I'm sure I've missed a couple countries, but we will be taking forward some of the messages that came out of this webinar today, and closely following and reporting back on, as I said earlier, one of the most consequential World Health Assemblies of our lifetime. So please do follow this space. Please do keep track of PHM on social media and on the PHM website. And I'm sure there'll be plenty more opportunities for discussion moving forward. With that, I want to thank everybody for joining us, and I'll close the webinar now. Thanks so much.